Hi, good morning, everyone. My name's Hayley. I'm a midwife for private midwives. I'm going to be presenting to you today. It's going to be about 15 minutes. I'm going to talk about how we're prioritising safety in a post-COVID world. So if you just bear with me a second, I'm going to share my screen with you. So we're on the slideshow. So here we are as a presentation. So I'm talking about how I'm going to prioritise safety in a post-COVID world. It's presented by myself, Hayley Parkhill. I'm currently a midwife working for private midwives. So I qualified back in 2013 and I've had many years of NHS experience. And then I went back into independent midwifery. And then I found a company called Private Midwives. So that's where I am now. So my priority is caseloading and continuity. And it's all about choice for women and their families, especially during the pandemic. And obviously with a focus on safety throughout their whole pregnancy journey and their birth and their postnatal period as well. So here's a presentation. So infection control in childbirth, a midwife's perspective. So pregnant women are at no greater risk of becoming seriously unwell from COVID-19 than other healthy adults. In fact, the vast majority of mothers who contract the virus will only experience mild or moderate symptoms, and there is no indication whatsoever that the virus causes problems with the baby's development or leads to miscarriage. Nevertheless, pregnant mothers have been included in the National Health Service's list for people at moderate risk. So this is defined as clinically vulnerable, just as a precaution. A recent study by the UK Obstetric Surveillance System, or UKOSS, examined the outcomes of 427 pregnant women admitted to hospital with COVID-19, along with their babies in the UK during the 2020 pandemic. It concluded that most had good outcomes and that the transmission to the virus to the infants was very uncommon. Of those who did become seriously ill, the majority were in their third trimester of pregnancy, with a large proportion from Black or minority ethnic groups were admitted with infection. This evidence supports the government's recommendation that all pregnant women should pay particular attention to social distancing measures and reinforces with the need for good hygiene, particularly at 28 weeks into the pregnancy and beyond. So the UK OSS study also found that outcomes for babies born to mothers infected with COVID-19 were mostly good, although almost 1 in 5 were born prematurely and were admitted to the neonatal unit, and fewer than 20 babies were born very premature when the women were 32 weeks or pregnant or earlier. I've noticed working for private midwives, we've been extremely busy during the pandemic, mainly because pregnant women are avoiding the healthcare settings. So we've had women book, obviously with private midwives, you have care in the comfort of your own home, and a lot of women are booking for home births. So although the despite of low risk serious illness and the general good outcomes, it's possible to give an absolute assurance to mothers that our risk of contracting COVID-19 for her baby is any greater than for a healthy individual who is not pregnant. It's therefore understandable that some mothers may be anxious about entering a healthcare setting during the pandemic. Well, not just for their own health, but that of their newborn and their family members as well. In fact, research has found a reduction in care setting behaviours among pregnant women. A study conducted at St George's University Hospital in London compared data from February the 1st to June the 15th in 2020 with the same period back in 2019. It also reported a significant decrease of 19% in the number of women attending obstetric triage. This suggests that women may be avoiding seeking care where possible, reflecting the behaviour observed among the general population in the UK during the pandemic. The study also recorded a reduction of 6% in the number of births, which may mean that women are opting for home births. So like I said earlier, we've been very busy at private midwives with women wanting to book to have their baby at home. So to continue with women avoiding healthcare settings, the importance of ensuring mothers feel comfortable and relaxed during their birth should not be underestimated. So stressful and unfamiliar situations and surroundings may increase stress levels and decrease oxytocin. Alternatively, situations perceived as safe, familiar, friendly, and supported by the mother are likely to do the opposite, promoting oxytocin release and facilitating as the labour progresses. So we also want to ensure that the woman feels safe and protected in the hospital or home setting, and it's therefore an important factor for maternity and infection control departments. She should also feel informed and reassured that all measures are being taken to safeguard her and her baby from infection, and that she has the best, most appropriate equipment for the maternity setting. So there is some guidance balance on infection control and mother's comfort and choice. So the Royal College of Obstetricians and Gynecologists, also in conjunction with the Royal College of Midwives and other key organisations, have produced advice and guidance for healthcare professionals and mothers reflecting the changes introduced since the start of the pandemic. This guidance strikes a balance, so it's between the infection control, the comfort and well-being of the mother and their baby, and also ensuring that their choice of birth plan is respected. It also highlights the importance of pregnant women attending antenatal appointments, but emphasises that visiting, including attendance of a birth partner or other supportive adult alongside the mother at scans, is subject to local discretion by NHS trusts or their bodies. Any other visitors must follow guidance in hospitals about social distancing, wearing a face mask, and regular hand washing. So this guidance points out that having a trusted birth partner present throughout labour is known to make a significant difference to the safety and well-being of women in childbirth. It states that while some hospitals and maternity units may put restrictions on visiting and attendance by birth partners during antenatal visits and scans, etc., this should not impact on their presence during labour. Its advice to healthcare professionals is to support and encourage women to have birth partners present with them during active labour and birth if they wish to do so, in accordance with local or national hospital policies. They should also permit an asymptomatic birth partner, not otherwise advised to be self-isolating, to stay with the woman throughout her labour and birth unless the birth occurs under a general anaesthetic. We should ask birth partners to wear a face covering, remain by the woman's side, not to walk around the ward or hospital setting, and wash their hands more frequently than usual. Of course, using the correct equipment for the maternity setting is vital. So the measures set out by the RCOG are thorough and are regularly updated. However, maternity units should also ensure that they use the most appropriate equipment to minimise the risk of cross-infection contamination, particularly when it relates to respiratory therapy. So the inhaled analgesia systems, for example, which are used by women in around 80% of births, should be suitable for the demands of the setting. In this case, the analgesic gas, nitrous oxide, and oxygen, or gas and air it's also known as, does not vary, but the handheld device through which it is delivered is attached to the gas source by tubing and includes a demand valve that releases a gas that the mother inhales. When the mother breathes out, most devices redirect that gas back through the device via a breathing system filter in an attempt to prevent contamination. Excuse me. So in an attempt to prevent contamination of the handset with the respiratory droplets in exhaled breath. These devices generally use generic breathing system filters, which can be up to 99.99% efficient at a test flow rate of 30 litres per minute. Some, however, may be 80% efficient or even less, as the flow rates typically achieved by women in labour. Studies have found that during childbirth, women can inhale and exhale at a rate as high as 300 litres per minute. This means that protection from cross-contamination is dependent on staff selecting the right filter, many which are not suited to the demands of a maternity setting. The use of devices specifically designed for a mother in labour is therefore key. Rather than using filters, these systems, such as the Autoflow, are fitted away with exhalation valves, which divert exhaled breath away from the handset, virtually eliminating the risk of cross-infection. Over recent years, I've chosen to use the Autoflow, and mothers have commented on how comfortable and quiet it is, especially at home births. Its lower resistance requires the lowest respiratory effort of any inhaled analgesia system. This means more energy is conserved for the birth. Conserving energy and receiving more effective pain relief will make her feel less anxious. She also has the choice to breathe more deeply, giving her greater control. This increases the chances of a normal birth and better outcomes. So here we just have a little diagram of the Autoflow analgesic demand valve. So it was shown by the independent test conducted by Cardiff University, the Medical Device Evaluation Centre, how they concluded that Autoflow outperforms other systems with a patient filter. So gas flows through an exceptionally low resistance electrostatic filter. So during inhalation, the one-way valve is closed, and during exhalation, it opens and gas is diverted away through the side vents. So do we need a review for a greater focus on safety? Well, the Better Birth Report, published in 2016, which followed a national review, set out a new vision for the planning, design, and safe delivery of maternity services, as well as a need for more personalised, professional and family-friendly care. It highlights the need for greater focus on safety, concluding that there was evidence for improvement and better leadership to create safety culture within and across organisations. Indeed, the COVID-19 pandemic presents new challenges for maternity units to ensure safety and optimise the environment to avoid infection and cross-contamination, whilst ensuring mothers feel as relaxed and comfortable as possible. Also, staying up to date and following the latest guidelines is essential, but the correct choice of equipment should not be overlooked. That's the end of the slide. Thank you for listening, and I hope you all have a good day. Take care, bye-bye.